All right. Hey, guys. Just making sure everything's set to go tonight. It's another Wellness Wednesday. So you made it. While we are waiting for uh, everyone else to jump on, uh, I've been, thinking about the topics that I, want to share on these events. I try to think of topics that'll be relevant and uh, relevant to you as those of you who are suffering from a lot of different symptoms, and as you try to figure out what's going on with how you're feeling, um, it takes a lot, and I want to talk about something that's pretty unsettling. Tonight's topic is pretty unsettling, honestly. When you're trying to figure out why you're so tired and fatigued and overweight and even swollen, dealing with brain fog, trouble concentrating, skin issues, anxiety even, or insomnia, and especially gut and digestive symptoms or issues. We talk in functional medicine about the root causes for chronic symptoms, right? And it's not uncommon to talk about infections like viruses or bacteria, especially overgrowth of bacteria in the intestines. It's perhaps a little less common that we talk about, but certainly common enough, I guess, yeast and fungus infections. But doctors don't even consider this cause. We should talk more about parasites. Yes, worms. There was some research done for transplantations, and the research explained how parasitic worms penetrate or pass from generation to generation. Worms penetrate every organ in the body, which means that they penetrate the uterus. And so then they travel in the blood and lymph. And so if they're in the uterus and they're traveling, once they're exposed in the placenta, they travel down the umbilical vein into the liver of the fetus, the developing fetus. Now, they start a new cycle in a new host. And so because the worms are introduced into the fetus before the immune system develops, the worms are never recognized by the host's body as foreign. And so the immune system never develops an adequate or perhaps any response. So the take-home point is we all have worms. I know it's disgusting to think about. And our immune systems don't really see them as invaders. They don't see them as a problem. The problem is the worms, they feed on us. They feed on our minerals, our vitamins. This suppresses our systems, our organ function, our immune system. And they have been shown in research to cause cancer. In 1926, the Nobel Prize for Physiology and Medicine used parasitic worms to induce cancer. So the immune system, like I said, may never ever recognize the worms, and they've actually been shown to cause cancer. The issue with diagnostics now. Okay, so let's talk about, well, are there any tests? People ask me all the time, Dr. Redd, how do we test for worms? Testing for worms is really difficult and very inaccurate. There are a very few blood markers, and I have patients fill out a questionnaire which asks about travel, certain physical symptoms, lifestyle habits as a child, etc. So there are there are ways we can kind of tease out the probability of you being exposed to even more worms. But most doctors, if they are suspicious at all about worms, will order stool tests. Well, that should be pretty good. But stool tests, on occasion, they'll show a parasitic worm infection, and that's pretty nice, but it's really rare. Most of the time, they don't show anything. Why? Well, the worms are happy in the tissues. They do not want to come out. They're happy where they are. They're safe. They're getting fed. Really, until we take measures to treat parasites, do they start to get expelled. So I wanted to talk to you just a little bit about some of the treatments that are available for parasites. And there are a lot of herbal preparations, formulas that work very well. And some of them, they've come a long way since the kind of the first treatments we've had with like black walnut and clove, and so there are some really good herbal preparations to help with parasites. But sometimes we have to go even further and do anti-parasitic medications, and most are pretty safe, and they are fairly effective. But they're not often dosed in the right way when a traditional doctor is prescribing them. So the treatments, worms can become resistant to treatment, to even these pharmaceuticals. And so what I have found in practice over the years is parasite treatment can take several months. And you have to be patient with the process, and you have to be prepared sometimes for what you'll see. But sometimes you don't see anything. The worms that we are born with are a pervasive species that they're everywhere. They're called strongyloides, or threadworm, and they start out being microscopic, and most of the time they stay that way, and they are small enough to go into the cells. And so when I said they are able to penetrate every organ, it's because they are so tiny. And this transplantation research, where they were looking at organs, that's how they found that these worms were in all of these organs. So we know from this research that this is how we are exposed, even as developing fetuses before we're born. So yes, you can always thank mom for the gift that she gave you with these, but it's important to consider these as a cause of degeneration, of inflammation, of the symptoms, some of the symptoms that you have that, most of these can be attributable to thyroid disease. But if your thyroid's doing well, then maybe it's something else. So I do want to tell you about a couple of examples of some of my patients that I have treated for worms and have seen some pretty dramatic results. I'm going to tell you about, so Ida, she was being treated for diabetes to help her reverse her type 2 diabetes. And she we took her through her treatment plan, and part of that was treating her for parasites, as was evident in her blood and in her stool test. And it was so fun for when she came back, one of her visits, told us that, well, she had gone back to her eye doctor, who was doing a follow-up in preparation for doing her cataract surgery. She was having both eyes operated on to remove cataracts. And well, she didn't need the cataract surgery anymore. She was 2 months away from having that done, and the doctor didn't really know what to say. She related this to us, and she said, he just said, okay, well, I guess you don't need surgery. And that was that. So another pretty dramatic patient that I want to tell you about is Michelle. And she was, and I should have said that Ida is in probably her late 60s or so in age. Michelle, a little over 70 years old, I think probably around 72, was being treated for diabetes and a thyroid condition. And if I remember correctly, she had hypothyroidism due to Hashimoto's. And when she first came in, her skin was so red. She was just covered head to toe in eczema. I mean, her neck, even her face, her arms, and she showed me her arms and her legs were just red. And she was so uncomfortable, and it burned and it itched, and just she was done. She was done with it. As we went through her treatment plan, also realized that from the testing that she had worms, and we went through things. And about 4 months in, she had about a 50% reduction in her skin condition. About 6 months in, she was down to about a 75% reduction. And by the time she was done with her care, she had completely cleared her skin up. And my goodness, she was also 50 pounds lighter. Had with her thyroid, it was interesting. A little side note: she started growing her hair back because she had been losing hair, which is pretty common, as we know, with thyroid disease. And she was growing curly hair, and it was coming in quite a lot. And she was quite surprised. And she said, basically, like, I guess this is the new me. But pretty dramatic with treatment for parasites. And part of that whole story was she was able to show reversal of her type 2 diabetes. So yes, very dramatic outcome with that. Let's see. So I want to also tell you about Maria. And this is probably one of the most dramatic treatment stories that I've had in my career. And it's kind of sad too, as she started, as this all starts out. I will share with you, some of the frustrations that I have when I mentioned before that doctors don't consider parasites as a root cause. And Maria came to me with concerns about going blind. And she had 3 children who had, and one was a teenage girl, and then 2 were younger age boys, maybe like 8 and 6 or 5, something like that. And they were all having issues, a couple of them with their vision as well. And the teenage girl with really bad eczema on her arms, like in the creases of her elbows and her knees. And she would not wear short sleeve shirts to school because she was just so embarrassed, always wore pants. Beautiful little girl. And she just was so self-conscious because of this. It turns out that the family had adopted a stray dog and didn't have any treatment, hadn't received any treatment, certainly for parasites, like dogs should have. And as Maria sought care from ophthalmologists because her vision was going, it's sad to say, but she was literally laughed out of a couple different doctors' offices, made to think like she was crazy. One of the doctors had even told her husband, who had accompanied her and who was very supportive, that he needed to make sure she gets on an antidepressant because she was feeling rather depressed about this. She was losing her vision, going blurrier and blurrier, and they wouldn't believe her, that she thought that she had parasites from this dog, and she wasn't being listened to. She was being basically mocked and scorned for thinking that this was due to worms. The third ophthalmologist was the worst, and she was traumatized. When she and her husband came in to talk with me, she could not even look me in the eyes. She was so embarrassed to even tell me what was going on. Her husband had to do most of the talking. And as he told me this story, she got pretty emotional and just out of embarrassment, just utter embarrassment. I reassured her that I was listening, that I believed her, that she probably did have a parasitic infection causing this sudden, progressive loss of vision. And we talked about her kids, and we talked about what she needed to do, and talked about what it would take, and made sure that she set the right goals and had the right motivations to do everything I told her to do. So as a result of parasite treatment, she now sees better than she ever did. And her thyroid is much better balanced and in control. She was able to lose some weight. Her daughter, I treated the family for parasites. Her daughter's eczema cleared right up, and they had to do some hard things, but the treatment really worked, and the little boys had their issues cleared up, and so pretty dramatic outcomes for with parasite treatment with these patients. It's been so neat to see some of the turnarounds that I have seen. And I just want to reemphasize the need to look beyond the usual suspects. This is the forgotten root cause, I believe, of so many of our ailments. Our I mentioned before, the fatigue, the tiredness, the fogginess in the brain, certainly skin issues, itching, and rashes, eczema, so gut issues, gut infections, where these are not just bacterial overgrowth, but parasitic infections that cause inflammation, cause these symptoms, and we just have to pay more attention to these things. So they're not as rare as we might like to think. I think that's all I wanted to cover. All right, everyone. Have a great evening. Take care.